Hello dear friends, I am Dr. Archana Kamalakat. I am a pediatrician and in charge of the NICU unit in Curie Gynec and Birthing Hospital. So hello dear friends, we are putting up this video informative vlog after a very long time. Normally in the monsoon, we always speak to you about the various diseases that are commonly seen in the monsoon. In fact, it's become quite repetitive. The monsoon with its gastroenteritis, the dengue and other diseases which come in with the rains. However, this time it has been really very different, and I'm sure from the schools and from the play schools that your children are going to, you must be realizing that such a huge number of children who are falling ill. And this primarily is because for the last 2 years or more, the children have been staying at home, very well protected, not exposed to many infections, not visiting outside guests or even restricted in their play environments. Then all of a sudden schools have started, around May or June schools have started, and these children whose immune system has not been challenged so far in 2 years have suddenly been exposed to an array of infections. And as you all are well aware, there is dengue, that is in the air, hand-foot-mouth disease, a very common viral illness, a mild one most of the times, but sometimes giving rise to very high fever. An illness which is associated with rashes on the hands, feet, and the buttocks. There are rashes which are inside the mouth, and those are the ones that really cause a lot of discomfort to the children. This disease is transmissible from child to child. Generally adults do not get it, but there are a few cases where adults do suffer. So this is one of the diseases. The next thing is swine flu has made a comeback along with the seasonal flu. Those patients, in my experience, who have taken the vaccine for swine flu and who have been taking it regularly, have not had such a bad run with the flu, whereas those who have not have had this disease. And it can present from a very mild respiratory infection to some children who have needed hospitalizations because of very bad chest congestion or a pneumonia-like picture. Apart from the flu and the swine flu, there are other viral illnesses which come with pharyngitis or throat infection, and some which have regular viral features like body ache, headache, and fever. The stomach flu, or it is a viral illness which affects the gastrointestinal tract, comes with vomiting, loose motions, and high fever. So these are the various illnesses that are commonly seen this particular last month. So very often parents come and say that my child's immunity has really gone for a toss, doctor. Every 15 days I'm seeing you and there are repeated infections. So the explanation for that is that it's not that the immune system has gone for a toss, it's just that it's overwhelmed with the whole platter of infections that are there in the air right now. And there are some children who come every 15 days with a new infection. There is a hand-foot-mouth today, after 2 weeks there's a flu, after another 2 weeks there's a stomach flu. So it's literally passing the parcel. The kids are playing with each other in the school. Now, how to deal with this? And I would say the first thing to deal with this is with a whole lot of patience, because I can understand it takes a toll on the family, it takes a toll on the child and the child's health, appetite, and many other problems. So you need to be patient and you have to understand why this is happening. It's not your fault, it's not the fault of the child, and it's certainly something that you cannot really get over. So my suggestion to all of you would be that follow the principles of hygiene. Try to wear the mask where you are going into a public place, especially now with Ganpati coming. Try to wear the mask. I personally feel the mask has helped me a lot, especially when I'm seeing patients in the clinic. It really cuts down on these several virals that you keep getting. So do try to wear. I know it's really becoming frustrating to wear masks for so many years now. and take care of the usual, diet, exercise. Take those children out, let them get fresh air, let them play, and do not restrict them from going to school. I have parents who tell me, oh, after he started going to school, he's falling ill, so I have kept him home for 15 days. Now, what kind of damage you're going to be doing to these children by making them sit at home? So just let it be and just tide over this phase. I'm sure this phase is going to go off very soon. Once the children have a particular disease, remember that most viral diseases give lifelong immunity. Yes, hand, foot, mouth does give lifelong immunity, but we have seen children coming with recurrences. So let's put it this way, that viral infections are to be taken as a dose of an injection or a booster or a vaccine. And each infection is a result of the 2 years that your child has been sitting at home. Just tell yourself that. No self-medication, that is one principle, because some of the infections suddenly flare up into something very bad. Like a dengue can be extremely mild on the one end, and on the other end it can be extremely severe and can put your child into an ICU. So get the child assessed by your physician, your pediatrician, and always report symptoms which are unusual. So get the child examined, although it may seem frustrating that you are constantly needing to visit the doctor. So I think that in a nutshell, I can tell you this much. This phase is temporary. I feel that once the monsoon starts moving away, things will get better. Children will get more used to being exposed to various viruses. Their immune system, after the challenges, will emerge stronger, and hopefully soon we will have our happy, smiling, healthy children back in school doing what they are supposed to do, and that is to enjoy themselves, to learn and grow up to become wonderful and beautiful human beings. Thank you. I'm available in this hospital from Monday to Friday, and my OPD timings are from morning 9 to 11.